So hello, I can I start? Okay. Hello everyone, I am Dr. Shraddha Ganatra. I am a practicing obstetrician, gynecologist and infertility specialist. I have been practicing since last 14 years. Currently, I am a full-time consultant at Surana Hospital in Malad West. So today's topic of discussion and to uh, uh, thank them for giving me this opportunity to be live and to reach maximum people and making them what my today's topic is. So let me tell you about today's topic is cesarean aftercare. So, huh? Hmm? Okay. So first of all, let me tell you why the term cesarean has come into. The term, it was the legend Julius Caesar who was delivered by cesarean, and hence the term cesarean has been discovered. And it, those babies which are delivered abdominally, that is incision through the abdomen, cesarean sections. Now, cesarean is basically a procedure of delivery of the baby through the abdomen, and the rates of cesarean have increased nowadays. Why? Because initially, what deliveries we were performing vaginally before, like the breech was performed vaginally before, but it's not performed now. Now the mother themselves are demanding more of, they do not want to undergo vaginal delivery, so that's how the rates of cesarean have increased. Now the cesarean wound, how the cesarean is performed is by cutting the various layers of the abdomen, and hence while we are suturing it back, there is a wound which is left behind. Now, this wound, basically, any wound or post-abdominal surgery takes 6 weeks to recover completely. So, within the first week or the first 2 weeks or the first 15 days of the surgery, the wound is healed superficially, and the rest weeks, like next 4 weeks, it takes for the internal wound to heal. So, superficially, for the wound to heal, proper from the day one onwards, proper care has to be taken. Like healing is a process which is a combined process in which adequate nutrition is required, adequate care is required, and family and parental support is also very much important. So from day one onwards, post surgery, there is a vacuum dynaplast dressing which is given by the doctor, which is to be removed 1 week post the surgery. So normally in our center, we remove first 1 week post operation. So that on discharge, they has to be cleaned properly with soap and water. There has to be no rubbing, sponging of the wound. It has to be kept dry. There should not be any moisture collection in the wound. Also, the doctor will give you, like we generally give an ointment which is to be applied over the wound for the next 6 to 7 days. Uh, Apart from that, adequate rest, adequate fluid intake, good nutrition, all these helps in the combined wound healing. Yes. Second question. I'll be very weak and tired all the time. See, again, recovery from the cesarean is a complete package. You know, it includes the wound care, it includes emotional family support, it includes adequate nutrition with rest as well, and plenty of oral fluids. So, what is the question? So, so once you are discharged from the hospital, there will be supplements like iron and calcium, which the doctor will prescribe to you. So, timely taking of these supplements, timely rest when your baby is resting, you need to rest. See, all this will really to energetic all the time. The question is, after the C-section, the baby goes back, which feels like it's pulling all the time. Okay. The stitch healing 4 months after cesarean is what happens is the scar, which is the cesarean scar, is basically healed. It takes 6 to 8 weeks time to heal internally as well. And after that, little bit of puckering and stretching. Maybe if you have gained a little weight, which is post delivery, or you have lost some amount of weight, so the scar will try to adjust itself according to the weight, and there might be some kind of puckering or some kind of indulation which will give you the feel of a pulling effect uh, incision side. So that is very normal. But if the pain is persistent and if you are having rash or itching over it, then you should consult the doctor very immediately. Otherwise, little mild pain, a little mild puckering and pulling, which will generally subside by using a little amount of moisturizing cream, the pain and the puckering should subside. See, wearing an abdominal belt is generally recommended after first 2 weeks after 15 days of your operation. So once you have undergone a cesarean section, it takes time superficially for the wound to heal. It takes around 15 days, and post 15 days, is only the internal healing of the organs which is happening. So wearing an abdominal binder is recommended only after 15 days, and that is when the superficial wound has already healed. No, moreover, binder or wearing a cotton belly wrap or cotton dupatta, as what the Indian tradition is basically helps in just strengthening the tone of the muscles. But if it is worn too tightly or if it is not perfectly fitting, then it might also lead to acid reflux, indigestion problems, and sometimes hemorrhoids and sometimes prolapse as well. So this has to be used very carefully only and if it's needed. Secondly, abdominal binder is basically advised for little obese people whose abdomen is basically falling over the stitches, so that a little abdomen is kept tight, the belly is not sagging. So for that reason, an abdominal binder is basically advised only in those people. Otherwise, abdominal binder after 2 weeks onwards can be used, but after 2 weeks, then there are very less chances that it will infection or any other problem with the food. So mild exercises and walking once you are discharged from your hospital post cesarean, like on day 4 onwards, while walking at home, mild light activities like walking, jogging, uh, swimming can be done immediately, like from the first 7 days onwards, 7th day onwards. So, as I said, it takes 6 weeks for the wound to heal completely. Other kind of exercises or can be done only after 6 weeks. So what you should avoid is turnus exercises, overstretching, bending, lifting of heavy weight should be all avoided before 6 weeks and not immediately. So this is how what this is precautions you should be taking to avoid a heavy and other things. So the small takeaway message I would suggest is so post-partum post-cesarean care is not only care of the mother and care of the baby, but it is an overall care of the health of the mother in terms of adequate nutrition, uh, mild activity which the mother will keep doing, also parental support and emotional support to the mother. Uh, of the complete care post delivery. Thank you very much, and thank you, Shraddha, for allowing me or giving me this opportunity to talk on this platform.